my name is Dr. Asma Zafar and I am here to discuss some research articles with all of you. The purpose of doing this is to help my fellow dentists and doctors also who want to stay up to date with the recent researches and the recent advances in science. Alright, so I was going through some of the research that has been done in the past and I came across a very interesting article which was written by Helena Condotta in 2018. The topic of the research was mouthwash and diabetes, a cause for concern. Okay, so a very important molecule for this paper is nitric oxide. Nitric oxide is important here because it is very crucial for cardiovascular health as well as energy metabolism. Nitric oxide is usually produced by certain pathways. There's one which is amino acid oxidation and the other one is salivary nitrate to nitric oxide conversion pathway. A very important thing which we will be discussing in more detail is the second pathway, which is the nitrate to nitric oxide pathway. What happens here is the oral bacteria that we have in our mouth, oral cavity, helps to convert the nitrates into nitric oxide, and then the nitric oxide goes to the cardiovascular system and the digestive system and plays its role there. So here the lack of nitric oxide could lead to diabetes. In some of the other animal studies that were conducted in the past also suggested that lack of nitric oxide could lead to insulin resistance as well. Although the study makes sense, but there are certain limitations to it. So the number one limitation which they discussed is that the mouthwash they used was not specified. So they might have used a normal mouthwash, or was it antibacterial? We don't know. There are many different kinds of mouthwashes and some people use some kind and other people use other kind. So maybe very important limitation of this study is that the data that they included in the study was from the patient's self-reported use, which means it could easily be inaccurate. The third very important limitation is that the population that was included as a part of the study was obese or overweight, which means they were already at a higher risk of developing pre-diabetes or diabetes. This means that there was no relationship demonstrated between the use of mouthwash as a cause of diabetes in the patients. So now a lot of people still recommend the use of mechanical methods to remove the plaque instead of using chemical methods. So overall, the study was inconclusive because of the lack of sufficient data, and we cannot tell people not to use mouthwash only because it could cause diabetes.